Today I'm going to demonstrate how to insert and how to remove a nasogastric tube in a patient. Okay, so before you begin, you always want to look at your doctor's orders. So for now, I'm going to do the inserting first. So you look at the doctor's orders, and let's say that I did get a doctor's order to insert a nasogastric tube into my patient. Okay, so before you enter the patient's room, you always want to, you have to perform hand hygiene. Make sure you get the back of the hands, in between the fingers, the palms, the wrists. Okay, and then you want to respect the patient's and his or her privacy. So you draw any curtains and you close any doors if they are open. Okay, so now I'm going to begin my procedure. Good day, Mr. Preville.
Hello.
My name is Rae-Yanne and I'm going to insert a nasogastric tube in for you today. Okay, so before we begin, I would like you to tell me your name and your date of birth.
Rae-Yanne Preville.
Okay, and your date of birth.
January 14, 2007.
Okay, thank you. Okay, so before we begin the procedure, you want to always have a towel, because sometimes for that procedure, the patients might vomit and you don't want it on their clothes, so you have the towel in case. Okay? Then you want to look in the patient's nostrils. You use your lighter and make sure that there is nothing hindering or preventing the process of inserting the nasogastric tube. Okay, so when you're looking in, you can ask the patient, or you'll ask the patient to take a deep breath for you to see if there are any abnormal findings with their breathing or anything. Okay, and then you want to get whichever nostril is better. Okay, whichever one that you see better. Okay, so could you open your nose? Okay, you use a lighter like I said. Okay, so for this procedure as well, you would want to use gloves, but right now I don't have any gloves, so I will demonstrate it without the use of gloves. Okay, so to start off, you want to measure it to make sure, to see when you're going to stop inserting, okay? So you're going to measure from his stomach, from the thorax, okay? And then when you see it's like here, you're going to put a piece of tape so you will remember where it is. Okay, so it's right here. Okay, so you're gonna ask the patient to lift up his head. Okay, and then you don't want this too, you don't want it dry. You want it in the easiest and most fastest way possible, to insert it. So let's say that I'm putting it in the patient's nose. So I will insert it, put it all the way in. Okay, and then when it gets to the throat, most times the patients, they cough. So when they cough, that's a sign that, okay, he or she needs to lift up their head. So you lift up your head now, and then you'll give them a glass of water and you'll have them sip on it. Okay, so they will sip on it, and then you continue pushing it down. So that's making the process easier for the tube to go down. Okay, so when it's at its stop point now, when it's at its stop point, we're going to use a pan stick, that's what they call it, because you're going to put it in between the tube for protection, so that the tube doesn't come out. Okay, and then when you're done with this one, you want to put one on top as well. Okay, and then for security of the tube lower down, you will tie it to the patient's shirt or gown. Okay, and then that's how you do it. That's how you perform. Now, to make sure that the tube is in correctly, you want to do an X-ray, also oscillation for the air, and you can also use pH to identify the acidity or the how alkaline it is, for you to see that if it was placed correctly. Okay, when you're done, now in the process, if the patient complains of any discomforts, you want to record that, okay? Okay, so when you're done with this, you document it. You say what nostril it was placed in, and if you found anything abnormal, you document it as well. When you're done, you ask the patient if everything is okay, and then you perform hand hygiene. And that's it. Okay, so we performed the insertion. Now is the removal. So to begin, you want to flush air into the NG tube, okay? And then after you do that, you will ask the patient to take. But before you ask the patient to take a deep breath, you want to remove the tape that was holding it or keeping the NG tube on the patient. So you remove any of those barriers, okay? And then you'll ask the patient to take a deep breath and hold it, okay? So could you take a deep breath for me and hold it, okay? And then you want to remove the nasogastric tube, not as quickly as possible, but you want it very promptly. You don't want to delay on it, so you do it very gentle, okay? And you remove the NG tube, okay? And then you dispose of the NG tube wherever it's necessary, wherever the facility, whatever the facility has for you to dispose of it, where to dispose of it, okay? And that's it. You perform your hand hygiene.